Good afternoon, Ilsedora, or good evening. So I'm in Italy and it's evening, on my side of the world. So good afternoon and welcome.
Thank you.
And thank you for joining me for this conversation this afternoon, this evening. And I suppose, for our listeners and viewers, I think it would be important, for us to have an introduction and especially a thorough introduction of you. So our viewers and listeners will know more about who you are, and especially when in regards to the GNM and the GNM Institute that we're going to talk about today.
Mm-hmm.
So just briefly on me. So my name is Jean-Paul, and I was introduced to the GNM in 2012 by a friend who has sadly passed away. And from 2012 up until now, I've been learning. There's no books in GNM that I haven't read. So I've been learning GNM. I've done a lot of online courses. I've done a lot of workshops because I used to live in Australia. So I've done workshops in Australia's webinars, seminars, etc. And in 2020, through a Facebook conversation, I came across, so your name came up and I came across the GNM online seminars, which I looked into. And then from then on, I read that the GNM Institute was going to be launched in 2022. So I held off so I could enroll through the GNM Institute. And I have to say, Ilsedora, out of all the courses that I've completed from 2012 up to now, your course, there is no course that is as comprehensive as the course that I've done through the Institute, which is called the GNM for healthcare professionals. And at the end of the course, which I've just completed, so I was issued with a lovely diploma. And no courses has come as close as your course, because I've been looking for the gold standard course, and I have to say that your course is the gold standard.
Thank you. And I have to congratulate you because you've graduated now to be able to take the clinician course, and you got 96%. So that's quite an achievement.
Thank you very much. Thank you. And I wouldn't have been able to do that without, if the course wasn't as comprehensive and without your guidance, because throughout the course, as you know, you've given me a lot of one-to-one support. You've answered all of my silly questions. So thank you for that.
Silly questions. They're absolutely valid questions. And I'm always happy when a student asks questions because that means that they're interested.
Thank you for that. And so now we're going to introduce you, Ilsedora. So Ilsedora is a highly respected and highly qualified GNM practitioner living in Toronto, Canada, who is the first Canadian GNM educator, therapist, consultant authorized by Dr. Hammer himself. Ilsedora has also introduced the GNM courses and the GNM to other parts of the world, to South America, to India, to parts of the African continent. Ilsedora was introduced to the GNM in 1992 and was introduced to the master himself, the late Dr. Hammer, in 1998. And from 1998, Ilsedora has studied, has worked, has practiced very closely with Dr. Hammer for almost 20 years. Dr. Hammer entrusted Ilsedora with overseeing the translation of his work, of his thesis, entitled The Summary of the New Medicine, which was first published in German in 1994, and then into English in the year 2000. Ilsedora is the CEO of the GNMonlineseminars.com and the newly founded GNM Institute, which is an exciting new addition dedicated to GNM education worldwide. Welcome, Ilsedora, for our conversation this afternoon.
Thank you. Thank you very much for doing this.
Thank you. And hoping that I have, in terms of the introduction, hoping that everything is correct and everything is fair. please begin by telling our listeners and our viewers a little bit about what is the GNM. I think that's quite important because we probably have a few listeners that are new to the GNM and who discovered the GNM. And also, I think this is very important. Why is it important now, Ilsedora, to have an honest, truthful, and accurate GNM conversation, as now we are seeing that GNM is becoming more and more popular in the mainstream?
Well, what is the GNM? Well, it's really proof that our experience is instrumental in causing what we commonly call an illness or a disease state. Dr. Hammer discovered through his own experience, his own personal experience, with the dramatic shooting of his son by the Italian Crown Prince Victor Emmanuel, that no one is really going to be able to escape any kind of a dramatic event without becoming ill from it. And he himself developed a testicular cancer. His wife developed a breast cancer, and this was all as a result of losing his son. So when he developed this, he had a long conversation with his wife, who was also a medical doctor, and they both agreed that there had to have been something in their lives that was responsible for the onset of their cancers. And this was really when Dr. Hammer's research began. It actually began in 1981, about 3 years later, after his son was shot. So from there, he continued his research, and in 1986, he actually lost his license because he refused to deny his findings. So it's quite extraordinary, but that's what traditional medicine does. If you don't comply with the way they want you to practice, then they revoke your license. So he lost his license, but he continued his research. So that was the beginning. And he made a lot of friends. And of course, he also made a lot of enemies that threw stones in his way and blocked his progress wherever they could and prevented him from going public with his findings right up until the internet became a big thing in the late 1990s, and people started to put up websites talking about his work. So finally, his word did get out to the common man, to the general public, and people began to realize that there was more to medicine than just what traditional medicine gave us. So over the last, I'd say 10, 15 years, it has become more popular, and more of the general public have become aware of it. Even though Dr. Hammer was much maligned in his lifetime, he did still reach a lot of people, and he cured a lot of people, and he made some really extraordinary discoveries. And hopefully I'm able to continue to create that awareness around these discoveries, and also to help people to learn how to use the GNM correctly, which is instrumental. Otherwise, it's just a philosophy, which is really what's out there right now. No one is really teaching anyone how to use the GNM. And without knowing how to use it, of course, it will be lost. So it's imperative that we continue his work.
And is that, I suppose, like just leading into the question of the inauguration or the creation of the GNM Institute, is that what inspired you, Ilsedora, to found the GNM Institute?
Absolutely. When Dr. Hammer died, it left a huge gap. So no one really knew which direction to take. And I did have a conversation at Dr. Hammer's birthday celebration in Erlangen in 2018 with his widow, Bona, about the future of the GNM and the direction that we should take. So she agreed that I should continue teaching. But personally, she was more interested in getting everyday people to learn about the new medicine, or the Germanische Heilkunde, as we call it now. And which is fine. Everybody should know about the new medicine. But the thing is that no one knows how to use it. This is the biggest problem. So, like I said, it can easily be dismissed if someone doesn't quite connect with the kind of conflict that would be responsible for whatever ails them. So yes, it's very important that we continue his work and also the research, because the Institute is set up in such a way so that we can continue his research and not just continue it, but validate his research in the process. I think this is one of the more important aspects of it, because here we have a new generation of trained practitioners that are going to be using it in their practice, hopefully exclusively, which is the way it should be used. And from there on, and from their experiences, they can contribute to the research. That will actually be a mandatory part of the Institute.
Yes. And I am excited to be part of the program, to the clinician certificate program as well. So it sounds like it's going to be one of a kind. Yes. And which leads us, I suppose, into the conversation of, because as I've said, there are so many, and that Ilse, there are so many different courses out there where, like after a couple of weeks, people are, they're getting little diplomas here and there to be GNM practitioners. Yeah. And in regards to the program, the Institute program, so I believe that this is going to differentiate between who are the GNM practitioners that are true to Dr. Hammer's work and who isn't, because even in your course where I've completed the course, you've mentioned where there are certain practitioners where they are mixing modalities. Oh, yeah. And even Dr. Hammer has said that we have to be careful not to, because GNM in itself is the therapy, and when you know the GNM, you don't need anything else.
Mm-hmm. Absolutely right. Yes. Very little intervention is involved, and I think this is why traditional medicine took issue with what Dr. Hammer discovered. It cancels out a lot of the existing research out there, which is very time consuming, but it gets no one anywhere. And least of all the patient. The patient is constantly looking for that magic cure for their cancers, when in fact the cure is within them. And it is only in a very small percentage of patients that they would die from a cancer. And one of the biggest issues really is the lack of understanding that a patient has when they have that diagnosis. It's a death sentence to most people. So, and Dr. Hammer has freed us from that by helping us to understand the origins and the behavior of cancers. We have to understand that if someone becomes ill with a cancer, that it's not from a carcinogen, right? They had a biological shock. Now, there are some people out there in the GNM world that there's a lot of infighting, which is, so astonishing to me. I keep to myself. I mind my own business, and I don't mix with anybody else's business. And I find that there's a lot of infighting, and they're arguing, and it's really not nice in the GNM world to be observing this. We should have one goal in common, and that is to bring the information into the public and to not just create the awareness, but teach people how to use the GNM, because that's really where we will have our successes. Otherwise, it's just a philosophy. I learned early on that you just can't ask a patient when they had a starvation conflict if they have a liver cancer. You have to be very precise and try to understand when they got sick or when they developed this, when they were diagnosed, how long they may have had it, when they started to lose weight, when they started to lose sleep, and when they began to focus on a specific problem. And not just that, it's also the programming conflict that I look for now. And this is something that I found, I guess it must be about 22 years now. It was very early on in my relationship with Dr. Hammer that when I was working with him with my patients, obviously over the phone in those days, but it was very early on that I began to see that people didn't just become ill or didn't just become ill when they had a biological shock. It was the second time. So there was a programming event where everything lay dormant. And when I asked Dr. Hammer about this, he agreed. He says, you're absolutely right. But unfortunately, he didn't offer me an explanation. And I imagine that was because he didn't understand either. This was around 2004, 2005. It was a long time ago. But I began to work that way. And when I started to work in that direction, I got better results, because that's when we understood the reference point of their reactions. So they had a programming conflict, which became a reference point. And as soon as that was reawakened by something that was similar or the same, or even by a track, that's when they would develop their disease process. So it's, and of course, in the outer GNM world, not my GNM world, in the outer GNM world, they follow what Dr. Hammer says to a letter without following or looking for any other possibilities. So I can see why there isn't a great deal of success when you look for a conflict just in close proximity to their diagnosis, because the patient doesn't really know, they don't really understand how this process works. So it's not very complex, but you need to do a little bit of digging to be able to work this way, but it's worth it in the end.
Yes. And on the same topic, Ilsedora, so just from your, I suppose, from your understanding and from your experience, everything that you've had, in the last, in the decades of your experience, when someone would experience a conflict, let's say, as you say, the programming conflict, and then, as you've put it, so everything will lay dormant and there would be no manifestation on the organ level until the second conflict is experienced. Why do you think that nature does not create the manifestation on the organ level at the programming conflict?
Well, I think it has a great deal to do with nature making sure that we survive. I found that the majority of our conflicts that are going to be responsible for any given disease state later on in life, from our 40s onwards, are pretty much all experienced before the age of 20. So we've got a lot of programming going on in our teen years, before we actually become an adult. Then, of course, a lot of stuff happens to us in our early adult years as well. But they do become programming conflicts. So, and all they need to be is reawakened. And this is when the physical will respond. It does not in any way, shape, or form nullify what Dr. Hammer said about the DHS, that it will make a mark in the brain and simultaneously something will happen in the organ. Yes, it will. Absolutely. It is a DHS that creates this, but the programming DHS never comes to a physical issue. What's interesting, recently, as I was doing some research, I was checking one of Dr. Hammer's publications, and this one specifically on breast cancer, which hasn't been translated as yet. And because he always gives new information in each edition, so you have to delve through them. And what I understood from what he was saying, where a constellation is concerned, a constellation is a biological shock in one hemisphere of the brain, and then you have another biological shock in the opposite hemisphere of the brain, and it creates a specific kind of constellation. And he verified literally what I've been saying all along to my students and went public with about a year and a half ago. It's not the first time that you go into a constellation that you develop a psychosis. It's the second time. It's on the reawakening. So you see, he's verified it right there, but only by using the example of constellations. So yes, I think one of the biggest problems, of course, in the outer GNM world, not my inner GNM world, is that none of these people that are bringing forth this information have any experience with patients. So without that experience with patients, you cannot possibly understand what the patient is going through and what they actually need in the process while they're going through a cancer diagnosis, the kind of support they need. In some cases, it's constant, you know, they've been traumatized in the process. Then you need to unravel all of that and to set them back on a solid footing so they can recover. But it is a constant process, and you have to do constant damage control as well.
This is something that I found very interesting when I was doing your course, you know, when I compare, you know, with some of the other courses that I've done, where some of the other courses, it felt like the teacher was reading off the scientific chart. Whereas for your course, Ilsedora, the way the course evolved, you know, from the very beginning to the end, you know, when you gave examples of your different cases, but also what I found in your method, because I found that you have a method in terms of investigating and finding what the conflicts are, etc. But something very interesting which I gathered as I was doing your course is that not only were you of course you were helping the patients in finding their conflicts and to help them resolve, you know, to help them resolve or to help them, you know, like progress to go back to normotonia, as we call it in the GNM terminology, but you were also confirming Dr. Hammer's work. So there was I could tell in the way you were presenting, in the way you were talking about your patients, that you were progressing the research. So you were not just reading off a chart to tell the patients, this is your conflict, but you were also involved in progressing Dr. Hammer's research, which really sets you apart from all the other courses that I've done. So this was very engaging and very different in the way you presented your case studies. You could tell that you are so passionate about progressing the research, not just telling someone, okay, well, so you have a liver cancer, that was a starvation conflict. When did you experience this conflict? As I've I suppose experienced in other courses.
Mm-hmm. Right. Well, it's very important to continue and to verify his existing research. Absolutely. And as you know, I expect my students to go through that process as well. At the end of their certification, they will have to contribute to maintain their standing in the GNM Institute as a certified practitioner. So yes, I think this is something that was actually conveyed to me by a friend who is a professor and is in research in a university in Toronto. And she said, you know, this was long before Dr. Hammer passed. She said, you have to continue this research yourself, and every case that you work with has to be part of that research.
Dr. Hammer's work, you know, it's not only based on physical symptoms, but he also found the root cause or the causes of psychological and behavioral symptoms as well. If maybe you can, you know, maybe just elaborate just a little bit for our viewers.
Well, he finally managed to understand what we call schizophrenias. And of course, psychoses. So we're looking at mood disorders such as depression, anxiety, mania, bipolar disorder, paranoia, all schizophrenias. And he has made sense of them, which is quite extraordinary. But for him to actually admit that it wasn't the first, because we've observed this, you know, with the CTs, we see that there are patients that are in a constellation and yet they have no psychoses. What is the difference? So, and it's the same with looking at a CT of someone that has, say, a diabetes. And you would think that there would be a blood sugar disorder, but no, there's a target ring. It's active in the blood sugar center, but they don't have diabetes. So, and I found this early on, very early on, because whenever I had a CAT scan in my possession with the patient next to me, I would begin to ask questions about their health. And this is, of course, how I was able to verify Dr. Hammer's work through Dr. Robert Guinet, who was my first teacher. He was a protege of Dr. Hammer's. And when Dr. Guinet read my CT for the first time with me next to him, it was extraordinary. It validated Dr. Hammer's work. So whenever I had a CT with a patient, I would go through that same process with him. And of course, for them, it also validates the work. So you gain a lot of trust with the patient. So anyway, with respect to psychoses, again, it's the second time that you have a conflict that you will go into this psychotic event, or depending on how deep it is, but will develop a psychosis. So it's quite extraordinary that he has unraveled the mystery, so to speak. And, you know, if you can manage to solve one conflict in a constellation, then the patient can go right back to normotonia. So it's a matter of being precise. And this is what Dr. Hammer taught us. The precision is what helps the patient.
Yes, yes. And this is in your course. I think it's in module 3. So I know you've covered this in great detail as well. So, you know, for our viewers who'd be interested in taking the course, so I know that you've covered this in great detail. And this is one of my area of interest as well.
Yeah, of course. Well, we all want to understand that, right? I mean, it's where people find they have the least control and are the most vulnerable. If we have something physical, then of course, you know, we can deal with it somehow. But psychosis is very difficult. Now, with respect to the course, I will be expanding in the certification courses more on psychoses and on constellations because they are so misunderstood. But also in the intermediate course, the one that you're taking, I think most people also misunderstood that they need anatomy and physiology to be able to take that, which really isn't the case. They only need the anatomy and physiology if they want to graduate from the course. So if they want a diploma in it, but otherwise people could take it as a general interest.
Just before we conclude, you know, so we'll conclude, and I know, you know, like we've briefly touched on, in regards to the GNM going into the wrong direction, you know, into some of the other courses out there, and correct me if I'm wrong. So, for example, if someone, you know, like we have, for example, a patient, and they have been introduced to, you know, to the GNM, and they have certain symptoms, and then of course they are being, as you've said in one of your workshops, that because they are being pointed in the wrong direction, so they are being misled to barking up the wrong conflict tree. Yeah. And that would have not only are we wasting the patient's time and money, but that could have negative health consequences on the patients as well. Yes. So, and I believe this is why it's very important, especially, you know, through the Institute, to set things apart for people to know where Dr. Hammer's real accurate work is. So that at least, because I think if people are being misled, what could possibly happen is people could easily think, well, the GNM doesn't work because I've been told that this is a conflict and this is nothing that I've experienced in my life. So this is all quackery.
Right. Well, that's exactly my reason for making sure that people understand when the GNM is used correctly. It's not just a bunch of facts that you can see on the scientific chart. When this is used correctly, then we get the results that we want. And that's really why I started the Institute, to make sure that I have a generation of certified GNM clinicians that will be able to use the GNM correctly, like you. You're the next generation. You're the one that will carry this forward. And I have to thank you for that.
Thank you. No, thank you. And thank you, Ilsedora. Thank you for everything you are doing for the GNM world. Thank you for your ongoing support as I was completing the course. And I'm pretty sure everyone completing the course will feel exactly the same in terms of your ongoing support, always prompt to answer questions. I know that I've asked you a lot of questions and you've always been very thorough with your answers, and you know our viewers should know this. So if they are thinking of doing the course, that they are going to get very prompt ongoing support. So that's very important for them to know. So just before we close off, anything else you would like to add, Ilsedora?
Well, we also have some new courses available, not just the clinician courses, but GNM for everyone, a simplified version of the GNM, but I won't be teaching it. One of my proteges will be teaching it, Grace, who you may have met online. She will be teaching this course. So I'm really looking forward to seeing a simplified version. I always say it's hard for me to simplify it now. I know too much.
Yeah. Thank you so much, Ilsedora. Thank you for your time this afternoon and this evening, and I look forward to future conversations with you.
Thank you. I appreciate it.
Thank you.
Bye.
Have a good evening. Bye bye.
Bye-bye.